If you're considering rotator cuff surgery, a lot of people ask us, what can I expect after rotator cuff surgery? Now, as far as recovery, that depends on surgical technique. That depends on the severity or complexity of your repair, and then therapy protocol. Whether that's a protocol that the physician wants to use or wants the therapist to use, or whether the therapists have their own protocols that they're going by. And typically what you can expect is after surgery, you're gonna be in a sling that comes around, a strap coming around your neck, and there's usually a pad between the elbow and the side here, and you're gonna be in that sling that's called the abductor pad. That brings the arm out in order to take some pressure off of the tendons of the rotator cuff. And there's, whether you have an open repair, which is a large incision, or more commonly a 4-hole arthroscopic portal repair that's done, that's typically for a little less traumatic rotator cuff repairs. Either way, you're going to have some bandages on there, and that'll stay on for several days, and you'll change the dressing. And typically the first couple of weeks are the worst as far as pain. It's not terrible. The surgeon's techniques that they're using are very, very good now, and so sometimes pain is not as significant as it used to be, but you should expect to sleep in a recliner. Very few people are able to go back to their bed. You're going to be in that recliner for, it just depends, anywhere from 4 to 6 weeks. And again, that just depends on the person and how well they're doing. And you want to keep that arm propped up when you're resting at home. Surgical or therapy time after the surgery, depending on how soon the physician wants the therapy to begin, you're usually looking at somewhere at very minimal, very minimal, 12 to 14 weeks of therapy in most cases. It really should run around 24 to 28 weeks. And of course, if you're an athlete, or if you're going back to what's called an industrial athlete's work, so someone who's doing maybe oil field or pipeline construction, those types of things, we consider that an industrial athlete. So if you're going back to those types of things, you want to, the recovery process could be a little longer. Now that doesn't mean that in 12 or 14 weeks you're not able to return back to maybe your job, depending on what you do. But there are going to be some restrictions, and you want to continue with your therapy. So maintaining strength and mobility is very, very important, and also to have that therapist there, that healthcare practitioner, to try to kind of keep a check on things to make sure you don't re-tear something, because there is a re-tear that can happen if you're not careful. So, but that's what you're looking at after rotator cuff repair. Just like I said, be prepared to sleep in your recliner for a while. You're going to have the sling on, and especially if this is your dominant side, to be prepared to have some difficulty with your daily tasks that you do, just self-care things around the house. There's a little learning curve there. So I hope that helps, and thanks so much, guys.